Hi, so my name is Dr. Shaun Patel. I am a physician at Miami Skin and Vein in Coral Gables, Florida, and today we have a 27-year-old model patient who actually looks like a model, and we're going to do kind of pan facial rejuvenation. She came into our clinic and just wants to look a little bit more refreshed. We're going to be using a combination of neuromodulators, Botox cosmetic, as well as fillers. And if you take a look at her face, so can I have you raise your eyebrows? So we're going to soften some of these forehead lines with Botox. Frown for me. We're going to soften these frown lines right here with Botox. Big smile for me. And we're also going to treat some of these crow's feet with Botox. So neuromodulator in the upper face to relax some of the dynamic wrinkles. And then what we're going to do is she has these nice beautiful cheekbones, which she wants to just augment ever so subtly. And we're going to put a little bit of voluma in the mid-face, right along the zygomatic bone, as well as in the submalar area to kind of define her cheeks just a little bit more. She has beautiful nasolabial fold. I think it's normal to have some nasolabial fold, and I think in her case I'm not going to inject the nasolabial folds. She does want her lips injected. I think she has beautiful lips to begin with, a nice definition to her lips. The ratio of the upper to lower lip is slightly off. It should typically be 1/3 to 2/3 in height, and so we're going to put just a little bit more volume in the lower lip to bring out that lower lip pout. And I may also finish up with a tiny bit of filler right in the chin to just kind of balance out her face a little bit. And so starting with a good foundation here, this is going to be a fun case. Botox, filler. My filler in the cheeks is going to be Voluma. My filler in the lips is going to be Juvederm Ultra, and I'll probably use a tad bit of Voluma in the chin if I do decide to do that at the end. Alright, so at this point I've injected 0.2 cc's of Juvederm Voluma on the malar eminence, and then I've gone back along the zygomatic bone and injected another 0.2 and 0.1. So we've used a total of 0.2, 0.2, 0.1, 0.5 cc's of Juvederm Voluma on the mid-face so far. Now I'm just going to go to the zygomatical malar region, the submalar region, and just contour that Auger curve on her face. So at this point, we've put about half a syringe of Juvederm Voluma on each side of each cheek, and then I put about 0.6 cc's of, actually about 4 cc's of Juvederm Voluma into the chin, and you can see she has a nice cheek contour, the cheekbones. We've created some cheekbone support on her. We've also put a little bit of filler into the submalar region, as well as the anterior medial cheek on her. She has a nice Auger curve, a nice chin. We've really balanced, proportioned her face out nicely. So now I'm going to move on to the lips, and I'm going to be focusing on the lower lip, trying to improve the ratio between the upper and lower lip. That she needs a little bit more volume in the lower lip. There's also a slight asymmetry in the lower lip. The left part of the lower lip has slightly less volume than the right, and so first I'm going to try to even out that asymmetry, and then I'm going to improve the ratio between the upper and lower lip, predominantly focusing on the lower lip. There we go, okay? We've now balanced out the lower lip by putting about 0.1 cc's of Juvederm Ultra into the left lower lip, and now I'm just going to put a little bit more volume onto both sides to kind of improve that ratio and kind of improve the pout on the lower lip. now I'm going to move to the upper face, dynamic lines of the upper face. I'm going to treat her forehead lines, her glabellar lines, as well as her crow's feet. So that's the case. What we did today was we did Voluma in the mid-face, and you can see that nice cheekbone definition as well as that Auger curve. We put some volume into the submalar area as well. We also injected some Juvederm Ultra into her lower lip. The balance, we were trying to first correct an asymmetry and then also improve the ratio between the upper and lower lip. I put a tiny amount into the right upper lip tubercle, just kind of to balance that out, asymmetry out there as well. I put about 4 cc's of Juvederm Voluma into the chin, and I used 40 units of Botox for her upper face line. Beautiful model patient and beautiful result. Nice natural looking result, which is always our goal at our clinic here in Miami. Cool?
Yes, very cool.
Ah, awesome.